you for tuning into North Point, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by North Point Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and our listeners, we are partnering to create a healthier community. Today, we are joined by Dr. Kevin Gilliam. Dr. Gilliam is a board-certified doctor in family medicine and obesity medicine. He has been a member of the North Point family since 2009 and serves as our associate medical director. He's also been named MSP Magazine's Top Doctor Rising Star in 2017 and was recently featured in Star Tribune's Our Best Shot series promoting the COVID-19 vaccine. So welcome, Dr. Gilliam.
Thank you. Thank you.
Thank you. Thanks for joining us, and thank you for being willing to answer our questions around high blood pressure and hypertension awareness. So we'll dive right in. Can you give us a definition of high blood pressure, or what is referred to as hypertension?
Well, I think first it's important to know that blood pressure is essential, because we need an actual blood pressure. So to have a blood pressure is critical to life, because if you do not have pressure in your blood vessels, that is not consistent with living. So you need a blood pressure. The issue comes when that blood pressure gets higher than normal. And we consider normal to be anywhere at or less than 120 on the top, so your systolic blood pressure, and 80 on the bottom. So anything above that we consider abnormal, and then as it gets higher and higher is when you cross into hypertension or high blood pressure.
Thank you. Can you tell us some of the causes of high blood pressure?
Well, they're fairly variable. They kind of fall into two camps. I like to think of as things you can change and things you can't change. So some of the risk factors that people cannot change are their families. So if you have a strong family history of people that have experiences with or experience high blood pressure or hypertension, if you in your age is also a risk factor. So the older you are, your risk does increase. Your gender, men are more likely to have higher blood pressure when you're younger. So when you're less than 55, it kind of evens out between in the middle 50s to middle 60s. And then it actually flips to women have a higher risk of high blood pressure or developing high blood pressure or hypertension beyond the age of 65. And then another one of those things you can't change necessarily is your race. So those of African American or African descent have a higher risk of high blood pressure. And I honestly say specifically American-born Black people have a higher risk. And those Black people who are 2 or 3 generations living in America have a higher risk of high blood pressure for a variable number of reasons that we can get into. So those are things that you can't necessarily change in terms of risk for high blood pressure. And then there are several things that you can change. So physical activity is a big thing. So exercise, our diets, so the things we're eating, the level of sodium, fried foods, those types of things. Our weights can be a difficult thing to change or to adjust, but the work we would do to decrease our weight can help in lowering our blood pressure or maintaining a normal blood pressure. Alcohol use or the overuse of alcohol impacts our blood pressure. Tobacco use, so smoking, chewing tobacco. Stress. These last couple of years have been very stressful for the planet. So kind of an overabundance of stress, anxiety, and then lack of sleep or poor sleep. I think is one of the more important things that we tend to miss in people who have high blood pressure or hypertension, just are not sleeping well, which can lead to an elevation in your blood pressure.
Okay, thank you. So when looking out for signs and symptoms of hypertension, what should we be looking for?
Well, unfortunately, there aren't very many signs or symptoms when a person has high blood pressure. The key to figuring out if you have it is getting it checked, or
Right.
going somewhere. If you're at the pharmacy, at a Walgreens or a CVS, or if you're at North Point, sitting down in our machine, slipping your arm in there and just hitting the button, and to see what your blood pressure is. Or if you have a blood pressure machine at home, using it to see what your blood pressure is. There are some people who suggest that when their blood pressure is up, they feel, like they have a headache, or something like that. But those kind of symptoms don't necessarily correlate well, so they don't relate well, because we don't know if the headache was there and caused you to have higher blood pressure, or vice versa. So the best way to know if you have higher blood pressure is to actually check your blood pressure.
Okay, great. So you alluded to the number or the two numbers that go into measuring your blood pressure, systolic and diastolic. Can you break that down? What do those numbers mean, and what's going on when we measure blood pressure?
Sure. So I guess kind of even taking a step back a little bit, so we place a blood pressure cuff on your arm, so the upper part of your arm,
Right.
and so like in this general region here around your bicep. And what we're doing is increasing the pressure in that cuff, to actually cut off a bit the circulation in a blood vessel. And then as we release the pressure, listening for sounds, to signify what the pressure is, kind of flowing through those blood vessels. And what we're listening for kind of correlates into the top number and the bottom number. Now, that top number is what we call the systolic blood pressure. And I like to relate that one to, that's the work number. So that is the work that is required to kind of push blood from the heart into the blood vessels. And the diastolic blood pressure, which is the one on the bottom, that's the one I like to refer to as the resting or the relaxation number. So that is when your heart is filling up. So it's in a relaxed state for a moment, filling up with blood, getting ready to work again. And, a good visual I like to use for people is, because most people have inflated a balloon before. And so just, I brought my balloon just in case. I'm not going to blow it up, but, like a balloon.
Sure.
Like one of these things. So in order to inflate this balloon, you have to blow air into it. And so the work of inflating the balloon is the systolic pressure.
Sure.
Now, when you take a breath to get more air to try to expand that balloon even further, you have to maintain a certain level of pressure on the balloon. Otherwise, it's going to fly all over the place.
Sure.
And that pressure that you hold to keep the balloon inflated while preparing to give more pressure is the diastolic pressure. So that's the rest pressure.
Great. Thank you for breaking that down. That makes a lot of sense. And I think the balloon is a great way to sort of visualize and imagine where those numbers come from. And so my next question, I think you might have already answered it, but we want to know, what is normal blood pressure? What does that look like?
Yeah, I think a normal blood pressure is often different for everyone.
Mm-hmm.
But generally, we would say anything equal to or less than 120 over 80.
Mm-hmm.
You know, some people, a normal blood pressure for them might be 90 over 60. Um, and generally, that would be a smaller person that doesn't
Mm-hmm.
require much pressure to kind of maintain, you know, an upright state. If my blood pressure, because I am not what many will consider a smaller person,
Mm-hmm.
if my blood pressure was 90 over 60, you might have to be picking me up off the floor because that
Sure.
is not enough pressure to
Mm-hmm.
support my person.
Mm-hmm.
And but uh, most everyone else, a blood pressure in the range of 120 over 80 is what we consider normal. And then anything above that is when we start to investigate and to look into be certain that it is not hypertension or high blood pressure.
Okay, great. So pivoting towards health issues related to high blood pressure and hypertension, can you tell us what other health issues might be correlated with having hypertension?
Yeah, I mean it actually it runs the gamut, kind
Hmm.
of from head to toe. You know, stop if we start rather kind of at the top.
Hmm.
You your brain is in there,
Right.
and so higher blood pressure in the brain can lead to increased pressure in the vessels, which can lead to certain types of strokes, um, which is you know similar to when we move a little lower down the heart, increased pressure there can lead to a heart attack. So, a stroke is essentially a brain attack
Hmm.
where there's loss of blood flow to certain areas of the brain, or loss, if we're talking about the heart, loss of blood flow to certain areas of the heart. Moving a little lower down in this kind of stomach area, your kidneys. Higher
Hmm.
blood pressure can slowly damage the kidneys, and the kidneys are um, basically collections of millions and millions of little tiny little filters for the blood.
Hmm.
Um, and as those little filters get damaged, the the blood isn't cleaned as well, which can then eventually lead to kidney disease, and then it can lead to kidney failure, which at its end stage can lead to the need for dialysis.
Hmm.
And all that can be as a result of um, unmanaged and poorly controlled blood pressure or high blood pressure over a long period of time. Um, Moving even lower than the kidneys, higher blood pressure can lead to sexual dysfunction in both men and women. Um, we often tend to think more of men in this respect, but it can
Sure.
be in both. So it impacts from the top to the bottom in the body and throughout. There are other things that it does that I didn't mention, but those are kind of some of the top things that we think of as potential consequences of uncontrolled or poorly controlled high blood pressure or hypertension on a person's body and their health.
Absolutely. Thank you. What is the treatment for hypertension?
Well, it's variable.
Hmm.
It we tend to often think of medicine first, but that's not the first treatment option or the first thing we would do, because we would first want to have a conversation about what life is like for you or for that person. Um, you know, so we'd want to talk about the things you might be eating and the things you might be drinking, different habits you might have. You know, whether you know cigarettes or tobacco use or you know alcohol consumption, what your sleep patterns are like. Um, you know, there are different things we'd want to discuss before jumping right in to medicine, because we know that particular diets that focus on reduction in sodium or salt in the diet can have a fairly significant impact on blood pressure. You know, up to 10 to 20 point drop in the blood pressure with a shift in diet. Also, if have insomnia, or can't get sleep, or if you have what we call obstructive sleep apnea, where you're not breathing well at night, controlling or treating those things will result in the lowering or treatment of blood pressure. So looking at some of the contributing factors first, and then if we look at all those things and then decide as a team that we should, in addition to adjustments in diet, adjustments in lifestyle patterns, that we would need some medication to help in lowering the blood pressure, then we would introduce a medication. But we want to make sure that the central treatment of high blood pressure, the core of it, is rooted in making some adjustments in places in lifestyle that would impact the blood pressure. And usually, if we're able to do all those things through the support of our dietitians, through the support of our health coaches and other care coordinators, then we would see a really true reduction in the blood pressure. And if we need it, we can add medicine onto that as well, with the support of not just the primary clinician, but also our clinical pharmacist at North Point.
Okay, great, wonderful. So for those who want to look out for their health and want to prevent developing hypertension, what would you recommend?
Well, that's the golden ticket. So it's really kind of starting before you have it. Even and if you do have it, you can do all the things that we talk about. But it is really thinking kind of future forward. And so looking now at living as healthy a lifestyle, or healthy patterns of living as one can. So living an active lifestyle, meaning kind of taking the steps more than the elevator, whether you're vacuuming the home or sweeping, doing things to keep your body active, all those things count and all those things matter. Parking a little farther back in the parking lot when you're going to the grocery store, taking a walk. It's a little cold out at the moment, but you can still take a walk. And then being mindful of the things that we're taking into our bodies. And we oftentimes think that the healthier foods are those that are separate from however we might identify culturally with our own personal food practices. But I think kind of getting deeper into kind of core food practices from the different cultures, you then begin to see how healthy things were in the beginning of those particular food practices, and how heavily vegetable based those food practices are across the globe. And not saying that you need to be a vegan or vegetarian to live a healthy lifestyle. But it's clear that eating higher quantities of vegetables and fruit are better for you than some of the other processed foods that we might find in the stores. A good practice is, grocery shopping on the exterior, not exterior, but the kind of the periphery of the grocery store. You generally will find your produce, your meat sections on the periphery, so the outer rim of the grocery store. And then once you get into the aisles is where you get to the boxed foods and the bags and the cans. And that's when you start to get things that are more processed. So avoiding, some of the more processed foods and going for more kind of natural or whole grain things, taking some time to read labels,
So, our last couple questions here, we want to talk about prevalence of hypertension in ethnic minorities. And something you alluded to was specifically African Americans who've been here in America for several generations. So, I'm an immigrant from East Africa, so maybe this doesn't exactly apply to folks like me, but more folks who families have been here for generations. Can you explain what that higher prevalence rate is attributed to?
Yeah, we particularly at North Point, we um, have decided to really work and focus on the social determinants of health,
Mm-hmm.
um, which are the things that um, other factors outside of just primary care or clinical care that we do that impacts people's health. And one of those things, outside of the kind of economics and education and all that, are kind of racism, prejudice,
Mm-hmm.
and those and the like. And it's been clearly proven and seen um, that, particularly in African migrants, um, when the first generation migrates, the blood
Mm-hmm.
pressure control is it's normal. Essentially, it's there's not an increased risk, and not at the level of American-born um, Black people,
Mm-hmm.
and it's usually in that second and perhaps even in that third generation that you then begin to see an increase in risk of having an elevated blood pressure. Um, and that is often due or has been thought to be due to the incidence of kind of racism and prejudice against Black people
Mm-hmm.
in America, or Black people's experience with racism and prejudice um, that increases the risk and the incidence of high blood pressure and hypertension. Um, so that's kind of what I was getting at when I mentioned that that generational difference in kind of high blood pressure or hypertension. Um,
Mm-hmm.
and so we do have to think about those things um, because as I mentioned, stress is something that can impact your blood pressure, but there are also things that can cause stress on the body that we may not be cognizant aware of,
Mm-hmm.
um,
Sure.
but are impacting us because they kind of make up the social networks, they make up the social milieu, like it just in the kind of in the air, and just the things that stress you without you knowing you're being stressed about them
Right.
or by them rather.
Mm-hmm.
um, and so those are those social determinants of health that we talk about, that you people may have become used to, um, and don't realize that it's actually impacting them as heavily as it has. And I liken it, you know, with hypertension. So high blood pressure, as we mentioned, it doesn't have any symptoms necessarily. So your blood pressure can be high and you don't know it.
Mm-hmm.
And so you don't know that your body is being damaged by an elevated blood pressure until you have your blood pressure checked or you're kind of made aware of it. Similarly, if you don't know that potentially, due to certain socially determined factors, your health is being impacted. Um, you're just living life, and you didn't know, or weren't aware of these things, and you become aware, and then you can then begin to really address some of those things that you may have been addressing, but didn't know that it may have also been impacting your health and your
Right.
wellness. Um, you know, so just part of the reality that we live in, and it's part of the work that we do here, in not only bringing awareness but also providing resources and opportunity to address those issues um, in real and substantive ways.
Great. Great. Thank you. Well, that is it for us. Those are all the questions we had. So thank you so much, Dr. Gilliam, for talking to us about hypertension awareness. It is May, so it is hypertension or high blood pressure month awareness. And so I hope this conversation was helpful to our listeners. So thank you to Dr. Kevin Gilliam, Associate Medical Director here at North Point Health and Wellness Center.
Thank you. Thank you.
Thanks. Thank you for listening to North Point, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about North Point or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
You walk through the doors, we're here with open arms.